Hi, welcome to my program on infectious disease prevention and control. It is reported that the syphilis epidemic in Australia has recently caused a lot of attention. You might have heard of the sexually transmissible infection called syphilis, but what you might not know is that there's currently a syphilis outbreak across Australia. Dear fellow Australians, in recent years, Australia has witnessed a significant surge in syphilis cases, underscoring the need for heightened awareness and proactive prevention measures. Men who have sex with men, women of childbearing age, and those living in known outbreak areas are most at risk, including affected Aboriginal and Torres Strait Islander communities. Syphilis is a disease caused by a bacterium and it is treatable. In fact, with early diagnosis, most people can be completely cured. But we also need to remember it's a serious disease, and over time can cause sores and ulcers, rashes, skin lesions, swollen lymph glands, hair loss, muscle and joint aches, headaches, and fatigue, and if left untreated, can eventually cause brain infections, dementia, lung and heart failure, blindness, and even death. So how can we stop the rise of syphilis? The best way is to practice safe sex. Use condoms and dental dams, avoid sex if you feel unwell or show symptoms, and get tested regularly. Remember, people don't always get symptoms, so they don't always know they have it, which means even regular partners need regular syphilis tests. And if you're pregnant, early testing is extra important to ensure you don't pass syphilis on to your baby. So stay safe, get tested, and have regular health checks. This video aims to provide you with the latest statistics, insights into the impact of syphilis on families and society, and guidance based on the Australian Centre for Disease Control (CDC), its recommendations to help protect you and your loved ones. Current syphilis situation in Australia. Syphilis, a sexually transmitted infection caused by the bacterium Treponema pallidum, has seen a troubling increase across the nation. Recent data reveals that in 2022, Australia reported 6,036 syphilis cases, a twofold increase over the past decade. Alarmingly, the incidence among Indigenous populations is more than 5 times higher than that of non-Indigenous Australians. Additionally, 2022 saw 15 cases of congenital syphilis, where the infection is transmitted from mother to child during pregnancy, with 8 cases among Indigenous and 7 among non-Indigenous populations. While syphilis can be effectively treated with antibiotics, if left untreated, it can lead to severe health complications, including neurological and cardiovascular issues. The rise in cases, particularly among women with a 6-fold increase between 2013 and 2022, and HIV-negative homosexual and bisexual men, with a 55% increase in the same period, highlights the pressing need for public health interventions. Impact on families and society. The resurgence of syphilis poses significant challenges not only to individual health but also to families and the broader community. Congenital syphilis can result in miscarriages, stillbirths, or severe lifelong health issues for infants. The emotional and financial toll on families caring for affected children is substantial. Moreover, the societal impact includes increased healthcare costs and the strain on public health resources. Australian CDC's guidelines on syphilis prevention and control. The Australian Centre for Disease Control (CDC) emphasises a multifaceted approach to combat the spread of syphilis. Regular screening, routine testing is crucial, especially for pregnant women, sexually active individuals with multiple partners, and men who have sex with men. Early detection ensures timely treatment and reduces transmission risk. Public awareness campaigns, educating the public about syphilis transmission, symptoms, and prevention strategies is vital. Knowledge empowers individuals to make informed decisions about their sexual health. Partner notification and treatment, encouraging individuals diagnosed with syphilis to inform their sexual partners, promotes early testing and treatment, curbing further spread. Vaccination and research. While no vaccine currently exists for syphilis, ongoing research aims to develop one. Supporting and staying informed about such advancements is essential. Practical steps for personal and family protection. Protecting yourself and your family from syphilis involves adopting safe practices and fostering open communication. Consistent condom use. Using condoms correctly during all sexual encounters significantly reduces the risk of syphilis and other sexually transmitted infections. Open dialogue. Discuss sexual health openly with partners. Mutual honesty about sexual history and health status fosters trust and safety. Routine health checkups. Regular medical examinations facilitate early detection and treatment of infections, preventing complications. Educate adolescents. Provide age-appropriate sexual education to teenagers, emphasizing the importance of safe practices and regular testing. Stay informed. Keep abreast of public health advisories and updates from reputable sources, such as the Australian CDC. Conclusion. The rising incidence of syphilis in Australia is a public health concern that necessitates collective action. By adhering to the Australian CDC's guidelines, engaging in safe sexual practices, and fostering open communication, we can protect ourselves, our families, and our communities from the adverse effects of syphilis. Remember, proactive prevention and early intervention are key. Let's work together to ensure a healthier future for all Australians. Don't fool around with syphilis. And stay safe and informed. Now the video ending. If you like my channel, please give a like and subscribe. See you next time.